We now see how common vitamin D deficiency is and what role it plays in the body. We see how important it is to have a vitamin D level that's 30 or greater. But what exactly is so important about vitamin D for health? Let's take a closer look. Vitamin D was originally thought to only be involved in intestinal absorption of calcium and phosphate. In other words, only involved in bone metabolism and bone strength. It's since been recognized that vitamin D has multiple functions throughout the body. In fact, 3% of all cells in the body actually have receptors for vitamin D, far beyond its role in bone metabolism or absorption of calcium and phosphate. What we know is that vitamin D is involved in reducing inflammation and reducing immune responses. Inflammation is part of a common pathway to most chronic diseases. So reducing systemic inflammation can reduce risk of chronic disease and reduce progression of chronic disease. It has immune modulating effects. This reduces the risk of developing immunologic health problems like rheumatoid arthritis. Vitamin D levels also are involved in producing longer leukocyte telomere lengths. Leukocytes are white blood cells. Telomeres basically determine the lifespan of a cell and in turn the lifespan of the organism. So this can be a pathway that directly increases lifespan by increasing telomere lengths in leukocyte cells. And the downstream effects of normal vitamin D or adequate vitamin D level is a reduced risk of heart disease, of multiple cancers, and in multiple respiratory diseases. And as we've already said, a reduced risk in all-cause mortality.